Wow, good morning. Thank you all. I really appreciate this opportunity. It's not often that I get to talk about LGBTQ health equity. 20 years ago when I started this work, I never thought we would be here. I want to say, first of all, that I have 20 minutes to talk about 20 minutes of no data. And so the 2020 vision piece comes into my mind a lot while I'm doing this presentation. Let me see if I can get that good. Okay. I also want to thank Summit Housing, particularly for leading the charge here in Halton around collecting this sort of data and asking these 8 important questions. And I want to thank ROC, the Reach Out Center for Kids, for providing that youth voice. Youth is very important. That voice is very important, and youth count, and so thank you. Also, gender-neutral washrooms here. That's health equity. Thank you. That's a really good example of health equity. So I was asked to tell a story. And so my 20 minutes will be talking about a story. I'm going to share a story with another person that I had in my life. And it's that story, his story, that ignites my passion for the work that I do and for health equity for LGBTQ youth and adults. So like all stories, this one has a beginning, a middle, and an end. The beginning is the ignorance part, a past filled with holes and gaps and health inequities that would change my life forever. The middle is the last 20 years of no LGBTQ data here in Halton, but a tremendous intuition that leads to intuition and action, a call to action to fill these gaps on my end. The end is the now and the power of the data and how it can save lives. It's important to talk about these questions. It's important to ask these questions. I particularly think of the LGBT youth of color, the LGBT youth who have Indigenous status here that I think of a lot when I'm doing this work. I'm also a very passionate person and very passionate about this work, so I get emotional sometimes. So this is Nick. I didn't get permission to use his picture, so I blanked out his eyes because just to provide some sort of confidentiality. So Nick was my very, very first relationship as a young person. We met at a dance, and Nick has the most, you can't see it, but he has the most beautiful, stunning crystal blue eyes that I've ever seen. And in those eyes, I saw a spark and a drive like no other person that I've ever seen before. Nick grew up in a family that was not supportive of his sexuality, and neither were his friends, and he struggled with that in his life. When I met him, I tried to do a lot of work around supporting him through challenges with his family and challenges with professionals that he might need. He struggled to talk to his doctor. He's a family doctor whose parents went to the same doctor. He never felt like he had an opportunity to disclose his sexuality and some of the issues that his sexuality was preventing him from living authentically. So he struggled with his mental health, and we tried to help him through his darkness and depression. And he would tell me over and over again, I don't belong here. I don't belong anywhere. No one really understands me. No one really cares about me. I feel like I'm not important to anyone. Doctors can't help me if they don't know me. At the time, in 1982, in our community, there were no services to help with Nick's issues. And so Nick went on some meds, of course, and tried to build up some resiliency skills to maintain some sort of positive mental health. Again, he did not find the right professional or the right program to support him. So our relationship ended about a year later, and we drifted apart. I felt like I had done all I could do as another young person to support Nick. And so for many years, I would learn of his life through other connections and other friends. I know that he at one point became homeless, and he turned to survival sex, used drugs. I know that through the years, he continued to battle with his mental health and his health issues, and that he remained unconvinced that anyone could really help him. He grew up with depression, anxiety, addiction, and shame. So, if we can fast forward to the middle of our story, I had already worked at Street Health for a number of years, and I came to Halton in 1998, and I looked for LGBT community, and I couldn't find any. It was very, very dispersed. It was very, very secretive. There was nothing really here for LGBT youth and folks. So I started to respond to community needs. I got attached to our sexual health program here, and we started to know that they were collecting a little bit of data, I suppose, around sexual orientation and some Hep C and HIV conditions here in Halton. And so we started to know that there were LGBT youth here in Halton. So we started to respond to community needs. That looked like running one youth group once a month in Halton with 4 to 5, sometimes 10 kids here. But access to transportation, access from Acton down here, down to Burlington, Oakville area was non-existent and became a barrier. So I worked a lot with our community partners. I began to build bridges here in Halton. I began to start doing the work around supporting LGBT youth. Started doing training as well. People were interested in safe space training and positive space training. So I started to do that to give people language and to start making safe spaces in our mental health agencies and in our health agencies around supporting LGBT youth and families. In 2001, I met Nick again and was reintroduced to his life. I learned again through conversations and building our relationship back up that he continued to struggle with his mental health and his family, and he felt he wasn't successful. He felt still that nobody cared, nobody understood him. He told me that no healthcare or mental health professional asked him about his sexual identity, and he was still terrified to talk about it, so no one would ever get to the root causes of his issues. I have countless examples of asking sexual orientation and gender identity on your intake form and how it opens that conversation and keeps people healthy faster. This is why we need to ask these questions. So in 2003, after many years of untreated mental health and increasing health issues and ongoing shame from his family, we lost Nick to suicide. Nick's experience is what I call that ignorance phase of my work. The lack of knowledge that created the gaps and the health inequities in the LGBT communities, and Nick's death ignited me. It still does. So all of the work that I do is based on this need to prevent suicide around our LGBT communities and keep LGBT community healthy. So the question funding was always an issue. So doing the work, I had our own charity. I have ROC is now my lead agency and partner in our in the work that I do, and so this question around funding, right? Funding proposals, people want the data, they want those numbers. People want numbers, funders want numbers. They want to know how many people they're serving or we're helping. I could never give that number. How many How many LGBT people live in Halton, Marcus? Was a constant question. Well, I don't know, because we never counted. We never asked that question. People didn't ask that question here in Halton. There was even some times where that question became a barrier. And when I started to build some bridges in the community and build the awareness around LGBT health equity and inclusion, I was met with many, many different reactions. I was even met with one very high positioned person here in our community who said this to my face. Marcus, there are no gay people in Halton. But my work told me that there were gay people in Halton. My intuition kicked in, and I could even spout off a number because we had been working with LGBTQ, so I could say we have at least 10. Oh gosh. So my intuition told me that there were more people here struggling to find relevant and supportive professionals in Halton. I didn't have the quantitative data to support what people wanted. Because every good story needs a protagonist. At future meetings with the same person who said, Marcus, there are no gay people in Halton, I made sure that I dressed like this each time. So at least there's proof there is one gay person in Halton. That's actually what the youth do to me at camp. They decorate me with glitter and rainbows. I also pushed back. I pushed the community back, and when I get calls from epidemiologists who ask, how many gay people are in Halton, Marcus? I say, I don't know. You should know that. So I looked for areas where there could be venues that should be asking, and I looked for venues that could be asking these questions, and there weren't. These are some examples that I have found over the years, but there were none. We're not asking that question. Why are we not asking the question? I have some theories around it, and I have some proof around it, but it's still a mystery to me. I started sitting on committees. I started engaging with the LHIN, of course, to bring this issue to light that we need to be asking these questions. So these are some of the things that my intuition brought me to. This is current data that I have, not because we asked, but because this is our intuition and our experience that brought us to these numbers and these programs that we're running. This, again, is still, I'm not a LHIN-funded agency, so I don't have the HIA tool. I don't have, yes, I said that, Ed. So I don't have a whole lot of mechanisms. The mechanisms that I have are just the experience and the intuition that we work with here in Halton around LGBTQ identities, so sexuality and gender. So our intuition kicks in and we take action where it's needed. We continued to experience some suicide here in Halton around LGBT issues, and we had to act. The current grant allows me to do all these things is based on research from BC. It's based on research and data from BC because I have nothing here. I was again asked, when I submitted this, I again was asked, how many LGBT folks are you going to serve? How many are going to be volunteers? I don't have that data. I had to guess. And thank God they allowed me this grant. So I have to wonder, 20 years ago, if we had started collecting LGBT data, how further along we would have been. Would we have more doctors skilled in providing LGBTQ healthcare? Would we have more mental health professionals skilled in working with LGBT youth and families? So this proves, I guess, that data is collected in a lot of different ways. And so I can provide this data to funders. They still want that real hard data. So this is a very quick example of how data works. I recently attended the Rainbow Health Conference, and I met Alex Abramovich, who is the CAMH researcher who did his postdoctoral research on LGBT homelessness in Toronto. And I know I'm running out of time, so I'm going to go through this quickly. So we know that LGBT homelessness in Toronto and across the province is high, and there are lots of reasons, as you can see here. But Alex did some really great research and did lots of really great interviews. and success looks like. We have the Sprott House in Toronto is now the LGBT youth homeless facility. 25 beds, which are already filled up, opened in January. So that's one really great recent example. I also met at the Rainbow Health Conference. Stop looking at me, Mandy. I met at the Halton Rainbow Ontario Conference. I met the researcher who I used her research and her data to be successful in my grant. And so that was pretty powerful. So let's go to the present day here in Halton. The Positive Space Network was a facilitated implement site, and we did do a test. We did do the collection over a month in our youth groups, the 7 and 8 youth groups that we have. And we are providing feedback to the LHIN around our experience, and my student Brady is a human book today who will talk about his experience doing that. When I entered the data into the Excel spreadsheet, it came out that 23 out of 30, we only got to 30, youth indicated that they have a mental health issue. That hit me really hard. This is a really small example of LGBT youth in our program. As I said, we have over 120 now. But it's our intuition and our passion that told us that LGBTQ youth needed mental health and peer supports. So imagine if we had this data 20 years ago. Imagine. We can and are already responding to this. I already knew this. I already knew that our youth were struggling with mental health, and that's why I'm with ROC. That's why I did training with ROC, so that we can have mental health professionals in our community who can serve LGBT youth and families. We already are asking those 8 questions in our evaluation of our program. We're mandated by the ministry and by Trillium that we use the Students' Commission, and the Students' Commission asks those questions. So the future is here in Halton. Really it is. Data is powerful. The 8 questions also hit the intersectional identities of the youth that we see. So our youth of color, our trans youth of color, our Indigenous youth, our Two-Spirit youth who live here and need health and need mental health supports. So we have to be asking these questions. My vision of health equity includes the LGBT populations here in Halton. Thank you.